Hey everyone, welcome to our Summer Education Grand Rounds program. I'm Jeff Katzman. I'm going to introduce our esteemed speaker in just a moment here as we all settle down into our Zoom cells. Get started in just a moment. All right, welcome everybody. Good to see you in our third of 4 education programs, and the first one where the trainees and faculty are here together. So great to see you all. And the QR code and link to get credit has been up and will then be in the link so that everybody can sign in for this Grand Rounds. This is an education focused program with the first 2 sessions focused on feedback for the faculty. And this time we thought we would turn to our tremendous training director, Dr. Kristina Sowar, to talk to us about an area she knows well, which is generally about wellness. And we are very fortunate that Dr. Sowar has taken on this position. I think we all feel and know what a tremendous job she's done already, and how much light she really brings to the program. So thank you, Dr. Sowar, for that. And a little bit of background, since I've known Kristina for some years now. Dr. Sowar was born and raised in Boulder, Colorado, and she actually played competitive basketball through high school and went on to play at Yale for a few semesters. And during that time decided that she wanted to pursue a career in medicine. She ultimately attended medical school at the University of Colorado Medical School and went on to complete an internship in family medicine in Santa Rosa, California. And then transferred to our good fortune to the University of New Mexico, where she was a resident in our general residency program and then pursued a fellowship in child and adolescent psychiatry. She joined our faculty after graduation in 2014 and has remained with us, really developing an expertise in inpatient child psychiatry, as well as eating disorders treatment, in which she's really seen as a resource for the entire state of New Mexico, as well as wellness, where she is the director for trainees all over our institution and has connections all over the country. And I've gotten to spend time with Dr. Sowar talking about these concepts, and I have learned a great deal and just feel great fortune and gratitude, Kristina, that you're here today to talk to us a bit and to lead a conversation. I will, with that, hand the baton to you, and hopefully we can have some conversation at the end of the presentation today.
Definitely. Well, thank you so much, Dr. Katzman, for organizing all of our Grand Rounds and for the very kind welcome, and adding in a couple historical details too. So yeah, it's great to be with you all this afternoon. Thank you for making time to attend Grand Rounds. And yeah, we thought it would be good to kind of continue to set the stage for the year, coming in with some good foundational themes about how we juggle the tremendous amount of learning and clinical work and effort that we put in with wellness and how we are all taking care of ourselves and our community. So let me go ahead and share my slides. I will run through a slideshow PowerPoint, and then definitely would look forward to some conversation, feedback at the end, and we'll try to keep an eye out on the chat as well. All right, so I don't have any relevant financial disclosures for this content. So these are some of the objectives. One is to think about, like, what does wellness mean? It is a bit of a buzz phrase. I think a lot of times people hear it and, they can associate one of many different topics with it. So we'll talk more about wellness, about professional fulfillment, and also think about what contributes to wellness, what detracts from wellness at different levels, at systemic levels, kind of medical culture, and personal levels. And then we'll think more about, or reflect more about, personal resiliency and talk a little bit about sleep or sleep nutrition there specifically. And then I look forward also to incorporating Dr. Katzman back in as far as talking about some of the resiliency work that he's doing through ECHO. So quick kind of plug at the start. So I'm really fortunate to be a part of the Office of Professional Wellbeing. This is a separate office here in the School of Medicine that is really dedicated, I know there's a lot of words on the slide, but really dedicated towards focusing on well-being for students, for faculty, and for residents and fellows and staff. And, you know, it's a mix of both programming, trying to help in terms of education, being advocates at bigger systems levels here at UNM, and then also providing direct clinical care. And I think we are really super fortunate that our department provides, that we have such amazing individuals and that we provide a lot of the clinical care to many learners throughout our hospital. So Dr. Kilgore and Dr. Sanchez, who I think many of you know from our residency and faculty, are our two staff psychiatrists at this point at the Office of Wellbeing. And then Dr. Koyer and Ezechuku are our two psychologists who do a lot of therapy work. Dr. Lawrence is the Chief Wellness Officer, and then a couple of us do programming initiatives. And so just wanted to anchor in that in terms of feeling fortunate that we have this at UNM and hopefully can continue to think about within our department how we support well-being offerings for psychiatrists. This is the website. If you are looking for resources or interested in other events, newsletters, etc., about wellness, it's a pretty easy search engine, OPW or well-being at UNM, and it's usually the first to come up. Okay. So with that intro, when we talk about wellness, as mentioned, you know, people will associate so many different things with it. For some people, it's having time to exercise, it's doing yoga, it's working out. You know, for other people, it's getting help, it's getting therapy, it's doing the kind of personal development work that is important. For other people, it's time with family, feeling like they have adequate time to do the things that they want to in life, often kind of a balance with work and other pursuits. And then for some people, it's nutrition, it's travel, it's exploring the world. So I just wanted to honor that, you know, this is a really big kind of concept, and that, of course, wellness means different things to different people. So we'll just kind of explore that as we move ahead. This graphic has a lot on it, but I also like that it's capturing the 7 dimensions of wellness that SAMHSA had put together. And appreciating that this captures some of the depth of wellness, you know, so it's thinking about our physical beings, our emotional, intellectual, our financial lives, social, spiritual, environmental, right? So there's like all these different domains of wellness that we can think about in terms of both taking care of ourselves and our community and those around us. So I just wanted to pose a question. You don't need to respond to it, but maybe just reflect for yourself for a minute on how you gauge your wellness. You know, we talk about promoting wellness. We want people to be well, but it can be a good reflection just to think about, like, how do I know when I'm well, right? What are the kind of feelings, or how do I identify that I'm doing well versus I'm struggling versus I'm burned out, like, you know, along the spectrum of that experience. And then what is important to your wellness? So we talked about some things early on, but certainly there might be other aspects that are important to you. Maybe it's having a very meaningful career. Maybe it's, you know, having the opportunity to get to know people that you haven't met before. It's just appreciating that. I think the more we can know ourselves and understand what's important to us, the more we can feed energy that direction. Okay, so wellness is also, you know, something that we require in terms of training, that we talk about it. And there's a lot of energy in healthcare on promoting wellness and talking about it. And so just to take a minute to think about why, many of us are well aware, especially through COVID, that you know, we've faced some crises in terms of sustainability for those of us in medicine and as healthcare professionals. Looking at rates of burnout, looking at other health measures, mental health, depression, anxiety, PTSD, other things that people will experience during a medical career. And then also people choosing to stay in medicine versus feeling like I just couldn't do it anymore. I had to, pursue another path. It didn't feel like it had the meaning that I wanted when I went into it. And so I had to take another direction. So the sustainability component, of course, is really valuable when we think about how much we invest in training and in, developing our healthcare workforce and as individuals, our sustainable paths. And then from systemic levels, I think we all can identify that, when you have professionals who are in better states of individual wellness, certainly that will have ripple effects into the kind of care that they provide their patients, their presence, safety that can be related to, again, providing excellent care and being in a mentally good space. And then also team dynamics and finances, right? With if people are leaving medicine or if we're recruiting and thinking about retaining staff and healthcare professionals. Okay, so some statistics, and some of these are really humbling, I think, to read. There's been a lot of studies just drawing kind of the average. So recent reports showing that about 50% of physicians, both in training and beyond, that at some point meet criteria for burnout. In terms of other mental health professionals, including psychologists, I found bigger ranges, but somewhere between 25 to 60% that similarly meet criteria. And then it's been higher through COVID, but we know a large majority of nurses as well. When we look at studies on medical residents, so this is in all fields of medicine, about 20 to 30% of residents will meet criteria for a depressive disorder during training. Many physicians have anxiety disorders, many healthcare professionals do, and we don't always capture that. And then suicidal ideation, some of the studies again looking at physicians, saying about 10% of physicians at some point during their career will have significant suicidal ideation. And also somewhat elevated rates of substance use. So, it's, I think, just a good point for us to come to and reflect on, right? If so many of us in medicine are struggling to this extent, what can we do as a profession to be promoting the health and well-being of those around us? A couple slides, just again, looking at, as healthcare professionals, we have some acute stressors that people in other professions don't, right? We deal with complexity of humans and the seriousness of experiencing patient death, of medical error, feeling secure or not in our jobs, and then with patient satisfaction, patient dissatisfaction, our licenses, the concern about medical, legal, or malpractice, right? So all of these acute stressors that often are kind of swirling around us or that we'll experience day to day. And then chronically, many people in medicine will also struggle with decompression, right? Like being able to leave work and unplug. And so whether that's electronically disconnecting or just being able to, let go of some of the thoughts that we might be replaying about things that happen, patients we worked with, outcomes. And for some of us also, the concept of profession, like feeling isolated, that it's difficult to talk to family or friends about what we go through. And then other financial considerations like big loans. And then that many people who are drawn into healthcare also have traits that both make them good at what they do and tend to sometimes cause challenges in anxiety or in mood. So perfectionism, being really driven to self-sacrifice, and again, difficulty unplugging. And then on the right, recognizing that as humans, we all tend to encounter some of these variety of experiences between relationships and finances and health issues, et cetera. And then, right, we all walk paths to get into the careers that we have. And so honoring that, as mentioned early on, there's an increased risk of suicidal ideation amongst healthcare professionals, and that, often the risk factors for those are similar to what we see in other individuals, but that many people who go into medicine also have a history of trauma or difficult childhood experiences, ACEs, and, other mental health conditions too that can contribute. Okay. So, just like taking that time to think about the different stress that we carry on our shoulders, and then transitioning a bit here to think about the systems that we work in. And so many of us, as you go through your day-to-day, if you think about today or yesterday and maybe some things that have been challenging at work, might involve some of the following. So working with the electronic medical record or health record, we have some great advances that we've been able to experience, but also sometimes the challenges of navigating or just the administrative burden of the amount of things we need to do or the amount of time that we're spending can be part of it. Sometimes feeling like there's just so many demands coming at us from multiple places, and that can include having our Tiger and electronic communication with us all the time, but just feeling overwhelmed at points by the amount of need. And then also recognizing that, we work with a lot of people who may not be satisfied in their patient care with their experience. And the picture here on the bottom left capturing that, again, we've dealt with a lot of shortages in professions and disciplines that we rely on. So nursing shortages, staff shortages, and recognize that that can certainly contribute to stress too. So those, right, are fairly identifiable things that all can influence or detract from how people feel in terms of their well-being. And then we recognize that, when people are stressed and in need of help, it can be hard to reach out. And sometimes that's related to the fact that there can be pretty intense expectations on us, right? That we are the ones who are focusing on taking care of others. And where is the gap really for us to kind of be vulnerable and say that we need help, we need time, whatever that might be. And the stigma that exists around seeking help. So including the concern about if I seek out help for depression, and that's on my record, or my insurance will, what will the downstream effect of that be? Will it affect my ability to get licensed, especially if it's in other states that wording around obtaining a license is still somewhat contingent on if you have a mental health disorder historically. And that we have a lot of pressure on us in terms of, medical legal considerations. And just again, that we're not immune from other things going on around in the world, nationally and locally in terms of other stresses and cultural experiences. So, okay. So kind of a lot of heavy content starting out, but just to think that at this point, or, in medicine, there's an opportunity for us to continue to make some changes, or to start making some changes, or to embrace changes that can support our wellness at smaller levels and bigger ones. All right, so some of you perhaps have seen this before. Stanford has a large well-being division, and they've put together this model of professional fulfillment. So it's intended to capture the main components of professional fulfillment as healthcare providers. So it's a mix of both being in a place that has a culture of wellness. And so whether that's kind of, the smaller circumstances around us, or just in general, bigger culture of medicine. And then being in places that have efficiency of practice. So as mentioned early on, right, when we're more streamlined in terms of the administrative needs we have, or other things that are additional layers of requirements, that, that can certainly give us some time and energy for other things. And then personal resiliency, which is at the bottom, and sometimes feels a little easier to talk about because maybe a little bit more control we can have as individuals about that. But many times talking about wellness with people who are working in healthcare, I think there can be a sense of resistance, right? Like I'm tired of hearing about yoga. I'm tired of hearing about nutrition. A lot of what's causing me issues are the systems pieces and the bigger things around me, and I don't feel like I can do anything about it. And so I do think that, really where the trends are in terms of how we integrate and support well-being is thinking about bigger systems and cultural shifts that, we can support as individuals, but also advocate for and really seek at higher levels of our healthcare system. So how we improve our EHRs, how we have support to practice at the type of our licenses, the compensation structures, minimizing administrative burden, many things that we would all really like to see, and hopefully our continued goals within our system. And again, appreciating that a lot of times when there is a top-down approach, that there's a recognition that individual healthcare provider well-being is important, and transparency about that, and sometimes bidirectional feedback can be very meaningful for all of us working in bigger healthcare systems. And that, again, a reminder, we have these roles, in terms of advocacy, doing quality improvement, sometimes even just on the smaller teams that we are working on to embrace or support some of these shifts. I wanted to take a couple minutes to honor that there's so much overlap between wellness and DEI efforts. I mean, we recognize very much that having inclusive environments where there's an emphasis on diversity and open-mindedness and continued evolution of systems where there's been more historical biases or structural racism, that those can all be very positive. And then recognizing that for many people, especially if people are of underrepresented backgrounds in medicine, or just walking a path of identity that has not felt supported or discriminated against, that things like microaggressions, historical trauma, stigma, biases can really have a negative impact. And so again, at broader levels, just like, how do we continue to be inclusive? And then the learning environment also. So there's a fair amount of overlap, but I know we talk about it, within our teaching learning spaces here, like, how do we really cultivate learning environments that help people feel like they can provide feedback, that they can be psychologically in a safe space, that there's inclusion, and that there's some balance to service and learning are all, again, important features. All right, so, just, I know it took some time, but like to acknowledge all of that, and recognizing that, it doesn't always feel like we can change as much at those levels, but the good news is I think there are more shifts within bigger systems in medicine to take care of the workforce. Of course, there are a lot of big functions with finances and insurance companies and other pieces that can also make that complicated. But now we'll transition to talk more about personal resiliency. And so this quote I really liked in terms of thinking about what resiliency means. And so the definition here, that it is the process and outcome of successfully adapting to difficult or challenging life experiences, especially through mental, emotional, and behavioral flexibility and adjustment to external and internal demands. So yeah, just encapsulating that, we grow so much through a lot of these challenges that we face, and that resiliency is a pretty dynamic component for us that's reflective of, kind of our ability to adapt and grow too. So there's a lot of things that we know contribute to individual resiliency. Practices around self-care, prioritizing sleep and working towards getting good sleep, nutrition, sometimes when it's quick and not expensive, but just ways to stay well sustained. And then other components like having adequate support, and some about our mental approach or our mindset, how can we be more compassionate towards ourselves? What provides us meaning? How do we prioritize what gives us meaning and is important to us when we have a lot on our plate? And other interventions like mindfulness that can help with our nervous system, experiencing gratitude, just really carving out the time and the breaks that we need. So there's a lot here. And, I think sometimes taking like the smaller steps towards finding some ownership and making some smaller changes in pieces that we feel are reachable, hopefully can go at least a bit of a distance, and also giving us a sense of agency and that we can help improve our resiliency. So I wanted to start by talking about support, and again, coming back a little bit to the Office of Wellbeing. So just as a reminder that especially for our residents and fellows, that we have the psychiatry and psychology options through the Office of Wellbeing. And then for everyone, including faculty, staff, outcomes and CARS are a couple other places that there are services that are supported and available. And then there are a lot of other community resources. I think in psychiatry, sometimes we're more familiar with those, but just recognizing, we have some different places to reach out. And then I wanted to also highlight here the peer support efforts that have been going on within the university, and some of this led by the team at OPW. But, there's more and more evidence coming out that it's one thing to kind of seek external support in terms of like therapy coaching, but another to be able to meet with peers and colleagues and talk about, difficult circumstances, difficult issues, and just the value of having that kind of connection. So we do have some various peer support options here, and I could let Dr. Coyer talk more about that perhaps at the end, but those can all be pretty valuable for us. Okay, so in terms of nutrition and sleep, I'm not a sleep expert. We certainly have some great sleep experts in our group. So I wanted to talk a little bit about the connection between nutrition and sleep. And I was thinking about this last night for some hours in PES, but we thankfully, I think a lot of our job in psychiatry can be done during daytime hours, but especially on night shifts, or when we're low on sleep, there are certainly some strategies that we can employ to improve how we're doing with our nutrition. So one is caffeine consumption. It takes about 30 to 60 minutes to reach the peak alerting effects from caffeine. So sometimes people will strategize a power nap where you drink caffeine right before a short nap, and then you get both the alerting effects of caffeine and the reduced grogginess that comes from the nap afterwards. So this has become a more popular kind of approach for people working night shifts or who are alternating shifts a lot. Coffee and the way that it works tends to be a better choice for tasks that involve physical activity, attention switching, and short-term alertness. Whereas tea is generally better for concentration and sustained attention. So it can be useful to think about what you'll be heading into for the day or for the night in terms of which form of caffeine you might be wanting to incorporate. And as noted at the bottom, I just wanted to give courtesy to Dr. Mikowski, who is out at Stanford as well, a nutritionist who does a lot of really great content delivery on nutrition and sleep. So then, and following from that, if you are sleep deprived, it's worth, and you need to stay awake for the day, worth having a protein-rich meal upon waking. And then when you're getting ready for bed or close to bed, having a more carbohydrate-rich meal to hopefully support sleep. Kind of the standard sleep hygiene strategies that we tell people about: avoiding caffeine, chocolate, heavy spicy meals within a few hours of bedtime. But if you are working a night shift, of course, staying hydrated can be really important. It can be worthwhile to try to avoid eating meals. Perhaps you snack, but avoid eating meals between the times that you're usually asleep. So if your usual sleep cycle is 10 to 6, trying to avoid eating big meals in those windows. And then consuming caffeine at the beginning rather than the end, so you can actually get some sleep afterwards. Pardon for the typo there, but drinking warm liquids at night can help increase core body temperature when a lot of people will feel pretty tired when they're up working overnight. And that chewing gum, there's some good evidence out there that it can actually help improve alertness, focus, and stress. So if you have a night shift, sometimes keeping gum with you can be an important tool too. Okay, and this one I wanted to borrow. This was from a recent speaker, Dr. Christine Olson, who's at Yale, from the resiliency series that Dr. Katzman's been pioneering. So just thinking of some other strategies that can feel a little bit more within our reach are, we talk on mindfulness, right? Like, how can we incorporate mindfulness? What are the benefits of mindfulness in terms of improving our sense of self-awareness, capacity, hopefully, to regulate or intervene accordingly when we're getting out of our good windows of tolerance. But this, I think, is a great suggestion around like, how do we think about taking pauses during our day that can promote a sense of like restoring our connection with the powerful aspects of what we're doing, the meaningful aspects of what we're doing, and just have this power pause theme to it. So, there are several components in terms of like our approach and mindset towards stress that can all be important to touch on. So mindfulness, many of us know that about just how we kind of regulate, how we develop that sense of self-awareness, how we're doing, connecting with meaning. So, what gives us meaning, whether that's based on a smaller project that we're working on that day or in a bigger picture, what are some things that are important for our meaning? Being aware of our mindset, right? If we've been in groups that there's a lot of negative talk or feedback, if we check in with ourselves, we might find that our mindset has also kind of shifted to one that's like, yeah, this is awful, or this whole situation feels hopeless. So I think we can be conscientious about that, and then also be thoughtful about reframing. And we know that for many of us, especially in medicine, gaining a sense of mastery and feeling capable with the content that we're working with can be very important. And then also recognizing that we matter to others, and that we have space for me time. All of these are like really valuable components to be able to check in with, especially if we're just needing to kind of take a break and reflect on where we're at. So so she put together this great action plan that, I think we could either just spend some time on in terms of like, where could you incorporate each of these individual questions, perhaps through your day, or when you feel like you need to take a pause, or even creating more of a formal action plan for yourself. So thinking about how to cultivate mindfulness, how to stay true to what's most meaningful in life, how to cultivate or maintain a positive mindset, how to strive for mastery, how to matter to others, and how to really carve out space for me time. So just some additional formal content here to think about. Beyond those pieces, a lot of people find that doing some additional coaching or mentorship can be really valuable, right? Like having the capacity to connect with people that have walked the paths that we're on, just be able to have support can also go a long way in terms of our mindset. And then again, often in medicine and recognizing, especially in training, it can be very easy to have experiences where it feels like we have little control, whether it's, through expectations that are required for us or just in our medical system. And so generally finding a mindset where we can shift and feel a sense of some accountability and some ownership over, the decisions that are important to our sense of meaning or to our lives can be some important steps too. And again, thinking about how we value ourselves, right? Like we spend a lot of time learning about how we take care of other people. We don't spend as much time thinking about how we balance taking care of ourselves. And so just like, how do we honor that to keep going? We need to value ourselves in terms of priority, time, whatever it is. And so again, just through this talk, hoping to encourage people to spend a little bit of time reflecting on that. And then gratitude, there's some good evidence about practicing gratitude and how that can help us shift mood and into more positive states of mind, and even just small, right? Like three examples of gratitude reflection at night, a few nights a week, how that can go a long way in terms of mood. So Dr. Katzman, I figured I would actually turn to you at this point, if you're free to talk a little bit about our resiliency echo.
I am free. So thanks, Dr. Sowar. This is a tour de force presentation about resilience. Our program, I'll put the link in the chat here. Hold on. If anybody's interested, I'll just talk about it for a couple minutes here, we received a grant from HRSA to develop a program for behavioral health providers, and now for all clinicians, now in conjunction with the Office of Wellbeing here at UNM, to really learn together about resilience and the components of resilience in kind of a multi-pronged approach. So on Mondays at 1 o'clock our time, Mountain Time, we have what we call work groups, and these are brief presentations, about 20 to 25 minutes, and then we break into different groups based on our self-identified levels in our career. So we have trainees and early career folks, and middle career, and seasoned providers and supervisors, and different groups, and led by members of our hub team who are from all over the country, really interested in resilience. And so that's actually been really nice. Many people have been calling week after week, and we have really a community of people that are becoming fairly well connected around these topics. And then once a month, we have at 2 o'clock what we call Resilience Rounds, which is a major speaker. So we have, for example, this coming Monday at 2 o'clock, Jonathan DiPiero, who really has been studying trauma and resilience since his experiences in 9/11, will be talking to us at that time. And then we, in September, are starting also once a month an office hours program where people can call in and talk about peer support initiatives they're working on, and we'll present theoretical cases or cases we know about, and talk as a group about how we can approach thinking about those. The whole program, I think, has built a sense of connection for people participating in it, and people, but we don't, to be honest, have a lot of trainees participating. And we don't know why, other than trainees are very, very, very busy. But we're hopeful that maybe some more senior residents can jump in and be part of our hub team or participate. We are really looking to reach out to trainees, because it's a great group, I think, to be involved in. And Kristina, your influence has been tremendous, and expertise from the Office of Wellbeing here has been great. So that's the general program. The link, if you want to register and check it out, is in the chat.
Thanks, Dr. Katzman. Yeah, it's been really fun to be a part of. I know Dr. Romero's had a role, and just some other people in our department that, it's, I find them inspiring to be able to attend on Mondays and just kind of like refresh the approach to the week. So that was, let's see, let me try to get back to my slides here for a minute. Yeah, so that was the bulk of the content. Wellness is just such a big concept that, again, we could spend a few hours, I know, covering each of the different areas here. My hope really is just to inspire a bit of time for all of us to reflect around like where we are in terms of our wellness. What does that mean? What's important to us? And what are some strategies that we can employ that give us a sense of making positive change, of prioritizing things that matter to us, and just really what will it take for us to be sustainable. So I know that we're ending a few minutes early, but I'd certainly be open to feedback, to other thoughts that people want to share. Sometimes the discussion on wellness can be really intriguing. So thank you very much.
People have thoughts or ideas, put them in the chat, or raise your virtual hand, or raise your actual hand, or just talk. So, let's see if we can just kind of take a minute here and see where we can get. Well, I think I want to start, Kristina, just because I really do think that you've really brought a strong sense of this to the department just in the brief time that you've been our training director. I have a lot of gratitude for that. I just want to thank you for that. You are focused on this in a very genuine, real way with the development of the houses program, of interest groups within the residency. And I know just even through our conversations, it's something you think about in a genuine way. And it's not just we should have a wellness program or something like that, but very genuine. So I just really appreciate that. I wanted to say that. And now I'm going to turn to Dr. Romo. Paul, can you turn your camera on and shoot us a thoughts or question?
Yeah, can you all hear me okay? My signal's really weak.
Yes.
Okay. One suggestion that may be helpful for others for the night shift is alternating nicotine gum with caffeine. I noticed over my career, if I drink too much caffeine to a certain point, I'll kind of feel my system get oversaturated. And so a way that I've found to get around it is I'll drink like 2 standardized cups of coffee and then chew 1 piece of 2 milligram nicotine gum. And that rotation like that can be helpful.
I think we just lost you, Paul.
It's something that I learned from a family member from somebody's family member who works like in a position similar to Secret Service. And so it seemed to be helpful for me. It's addictive though, just like caffeine.
Yeah, thanks for that. Other thoughts about this, about how people incorporate these ideas into their world, or barriers to that, or things about our program that we should know about? Any of the above?
I can share a thought. One of the most helpful things for me is to make sure that my patients on the unit are cared for the time that I'm not on the unit. So, having good sign out and getting that sense of reassurance from whoever is in PES that they got it, and that, if something happens, if there is a sort of like ongoing thing that could develop at some point, I think, that to me has been the, most helpful. I can go home and, be reassured that someone got my back. The second thing, and I'm guilty of this, is trying to be mindful in using Tiger. I think it sort of like opened the healthcare system, and people working on it on each other in a very unprecedented way. And, being mindful of the time that people send the Tiger and the content that they send. If it's something that can be emailed and it's not urgent and not clinical, then probably it should be emailed and not Tigered. And sort of, it's not just responding to the Tiger, it's what's gonna be elicited in someone's mind when they receive the Tiger. So you could be telling them something that they do not need to take action on, but it just busies their mind, for some time. So these are my 2 cents.
Thank you for the wisdom, Dr. Yaya. Thank you for turning on your camera too. Good to see you. Dr. Farrar, you turned on your camera. I'm wondering if you have thoughts to share about this.
Yeah, I'm hesitant, but I'm for no reason. So I was thinking about the night PES shifts now that I'm an attending, and I'm like super hesitant because I've found that now even one night will ruin my sleep for weeks. And, I'm just, after residency and having babies, I had years of kind of not great sleep. And so, I want to be able to do that, but I also am like, I don't know how to do it such that I'm not like, kind of then thrown off for a couple of weeks after.
Yeah, I would just say, I think it's a great point, and I appreciate you sharing it, because I think, a lot of us also find the night shifts, especially, long night shifts, daunting, and especially if it's sandwiched between a couple work days. So I don't know if anyone else has thoughts they'd want to share. I mean, I think it's I think it's also one of those things in terms of just honoring where we're at, right? Like some of us may be in spaces that it's easier to work overnights, or we can arrange our schedule accordingly. But sometimes I think, something I've been kind of trying to accept from previous paths is like, I think sometimes we're also just in spaces that it is, harder with other circumstances. And I think in medicine, we want to be able to do as much as we can, but yeah, that's my thought. I'm curious if other people have ideas though, how they approach it, if they're working nights or how they recover more effectively.
Dr. Delmore, I see you. I feel like, oh yeah, romper room. I see you, Dr. Delmore. You have wisdom on this. Well, I think that's a great point. I mean, I did it for 7 years or 6 or 7 years or something like that, and then kind of found I couldn't do it anymore. I kind of, to your point, Kristina, I think there is a question about kind of where you are in your life and what you can take on and how disruptive it is to your physiology and all that.
Yeah, thank you. And it looks like, I think it's Dr. Ansaldua at the VA, maybe, about efforts being made at the local, regional, national levels. Yeah, it's a great question about advocacy. I was listening to a webinar recently that was led by a professor out at Princeton. Now I'm drawing a blank on what field he was in, but he was just really talking about wellness as like kind of a macroeconomic consideration when you think about all of the different forces at play in the way that our society and healthcare runs, and kind of where wellness fits in or is prioritized or not, based on the strength of those forces. So I guess I would share at local levels, at least to my awareness. I know within UNM, we've struggled a lot in terms of turnover with nursing and staff shortages, faculty or other physicians migrating as well. But I know there is a lot of effort, in at higher levels about hiring nurses, about, just how to address the shortages. And I think within individual healthcare systems, individualized responses to focus on that. I don't know if Dr. Quinn is here or would want to share anything more from that level, but, I think in terms of advocacy, some people find it more helpful to be at like the APA or other kind of professional organizations and getting involved in advocacy from those levels that can include legislative work. And then sometimes it's really like within your clinic, within your hospital, within your smaller system, right? Where can you gain a role that will allow you to have more of a voice and advocacy? Those are a few thoughts I have.
Dr. Romo, you have one more comment.
Yeah, I just thought, just to Danielle's comment, your body will tell you death. And so you may want to do a study on yourself too, where you could figure out where your threshold is. So for example, you may be able to function better without getting that jet lag that follows you for days or weeks after, if you get like a certain number of hours of good sleep. A suggestion for a lot of the residents and attendings that are going to do a graveyard shift, what I do is I'll go to the call room, and instead of let my mind kind of remain in shallow sleep wondering when you're going to get your next call, you can try using your smartphone. And what I do is I'll put on a channel on YouTube that plays water. I like dark screen and heavy rain. And then what I do is what will happen is YouTube will stop playing what you're listening to let the noise of the text or a phone call come through. So it'll stop the sound of the waterfall or of the rain. And then it's kind of functions like a built-in system. One, it'll help you fall asleep and help you get to the deeper stages of sleep where you'll be able to recharge. And two, because the YouTube and the ringer can't operate at the same time, it'll turn that station off, and then you don't have to worry about sleeping through your phone calls. So sometimes those kind of little hacks can be really helpful, but trying to figure out what the pattern is can be really useful, because then once you know what the pattern and the problem is, you can pair it with different solutions that can help you get through.
Dr. Delmer, you've shared wisdom from the medical students in terms of.
Yeah, thanks, Jeff. Thanks, Kristina. Recently, the Office of Professional Wellbeing did a survey of the students who, I'm trying to remember, who were about to start this current clerkship year. And the 3 things that I listed in the chat were the things that they wanted for their wellness based on last year's clerkship students. And so those 3 things are: the more we can do things in person, since the results of the pandemic, so much being on Zoom was not helpful was not helpful for their learning. Number 2, really systems that support that careful balance of having them in the clinic or in the hospital when learning is valuable and not otherwise, and recognizing that they're not working full time, that they also have to pass these high stakes exams every clerkship. So giving them time for that, and then giving them support for that as well, because since there's so much tied to performance and exam performance and success and residency application. So those are some things from the medical student perspective that I thought I would share with you all. There's a big thing going on right now about medical students really wanting to not work weekends across all clerkships. And so nationally in education, we're kind of wrestling with that. And what are the benefits of clinical exposure on kind of not high times of clinical care versus wellness? And then what are the drawbacks of not having as much clinical exposure? And in terms of preparation for residency and faculty physician life or healthcare provider life. Thanks.
Right. Thank you. Thank you. Any last thoughts, comments from anybody? Dr. Sowar, thank you so much for a wealth of information and for continuing to really champion this for us. And we are very fortunate actually that our leader really has this as a fundamental driver. So thank you. Thank you for your leadership, and thank you for the talk today.
Yeah, thank you. Thanks everyone for joining, and always appreciate the inspiration on ways we can grow. I'm very grateful to work with you all. So thank you, and look forward to more grand rounds to come as well.